Living with a chronic illness can be a daily struggle, and for those with inflammatory bowel disease, also known as IBD, the challenges are very real. Inflammatory bowel disease is a chronic inflammatory condition affecting the digestive tract, primarily the colon and small intestine. In 2024, the global prevalence of IBD was estimated to be around 0.43%, with projections suggesting to rise to 0.57% by 2030. This is nearly 46 million people. From debilitating symptoms to lifestyle adjustment, IBD affects not just the body but also the mind and spirit. We'll be discussing inflammatory bowel disease with our experts today, who will share insights into the latest research, treatment options, and management strategies for inflammatory bowel disease on your favorite Health TV talk show, The Physicians. Stay tuned. It's another day with the physicians where your health is our business. My name is Dr. Martina Agbere, your regular anchor on this program. And with me, as usual, is my very elegant celebrity shrink, Doctor. I'm Dr. Emina Yusuf Kadri. Welcome to the Physicians where your health is our business and will always be, will always remain our business. This one you're shaking the head. It is always our business. I'm only very excited. I'm talking about your wig, the way you're shaking here at the it's like it's giving the wig is wigging. Oh no. Maybe I will talk about that another day. Yeah, let's focus on giving our audience very important realms. The inflammatory bowel disease. Always look for a couple of times ago, somebody said to me that, Dr. Agbere, I always look forward to watching your program on Saturday. It's educating, a whole lot of information like I get from it. And the important thing is that when I miss it, I don't miss on Wednesdays, and I just go straight to YouTube. Okay. So everyone, thank you so much for all the comments and the good things that you talk about the physicians. So at the moment, I'm talking about the inflammatory bowel disease, IBD. The thing I remember about IBD is the fact that in med school it says invisible disease. Like, it has so much impact in the life of the individual, but oftentimes those symptoms aren't always visible. So that is how it resonates with me, because the patients always come in such painful conditions. Like, I know pain is so debilitating that you can't really specify where it's coming from. Okay. Yeah. So now talking about the inflammatory bowel disease, it's very easy. Inflammation. Yeah. In the bowel. Yeah. Then just imagine your bowel and an inflammation there going on. The disease condition that is taking place there. You can't really lay your hand on the real cause. Okay? Yeah. So, and the unfortunate thing is that some of the symptoms that come that you notice is also part of some of the symptoms for other disease conditions. That is where, for me, misdiagnosis, underdiagnosis is a big, because some of the patients I know I have managed, directly, and of course not now as a psychiatrist, way back in med school with my senior colleagues and as a house officer, the most times they came in undiagnosed. High index, because they were mimicking so many other diseases until have you looked at this? And when a specialist comes in and narrows it down, it makes it so easy that you will have been generalizing. It's just this now, not knowing that it is IBD. Okay, now we have our experts. After watching the program today, a lot of people will go back and they're more enlightened. Guys, they also know the difference. There's no need to say it's mimicking this anymore. Exactly. And that's why we have an expert. So we'll be back after the short break. Just stay tuned.
Every day and in every way, enjoy that I find support. No matter the role you play, nutrient pack supplement for you and me. In your body, that I fight you.
Diravite nutritional supplement is loaded with essential multivitamins, minerals, and natural ingredients that helps you to be at your best. Diravite from LB Pharma. Diravite. Love yourself.
Welcome to your regular health TV talk show, The Physicians, where your health is our business. Today we're discussing inflammatory bowel disease, and in the studio, with all of us here present, is a very intelligent consultant pediatrician and also a gastroenterologist. There's no other person than Dr. Ezeoma Ifeoma. All the Omas are good spelling. It's making really radiant over there. Look beautiful. The Omas are here.
Always glad to be here with you.
So we're going to be talking about inflammatory bowel disease. You want to just give, is this a general overview where it happened, where it occurs, and what are inflammatory bowel disease?
Okay. Of course, it will happen all the time. Just like we said, always misdiagnosed or underdiagnosed. And inflammatory bowel disease is a chronic health condition where there is inflammation of the digestive system, the gastrointestinal tract. It can occur from any part of the gastrointestinal tract, from the mouth to the rectum, and is a lifelong disease. As I said earlier on, is a chronic disease. That means the person is living with that disease. It doesn't have any cure. So you can imagine it doesn't have any cure. What we do in management is just to control it and to maintain the control.
So, Dr. Ezeoma, just hold on there. Did you say it doesn't have any cure?
No, there's
Lifelong. It's a lifelong. When does it start? From childhood, middle age, or elderly?
It starts from commonly. It starts from adolescent and young.
Okay.
As well. So usually from 15 years to 25 years or 30 years.
So you mean the child that has that inflammatory bowel disease will live with it to adulthood?
Usually that's a common yes as people that it occurs in. So usually we now start seeing it in children. It's uncommon in less than 5 years, but now we're not seeing it in children. So when we see it in a child less than 5 years, we call it very early onset inflammatory bowel
disease.
Then if it occurs from less than 2 years, those ones we call infantile inflammatory bowel disease. And the worst part of it is that those that when it occurs less than 5 years, those we see in childhood, they usually come with the disease progression is very rapid. And sometimes by the time we are even making the diagnosis, because when it comes, they'll think maybe it's diarrhea or something very, very not seriously a disease. And when it comes with complication. Like we had one of our patients we are managing a lot. A 2-year-old child came in with us. We started managing when she was 2 years. Where as at that time, she was just having chronic diarrhea, and the mother just thought, okay, they were managing a peripheral hospital, thinking it was just normal diarrhea. Until, they now came to a gastroenterologist, started investigating on how he had it. And by that time, he had complication. He had breakthrough vaginal fistula.
Whoa. Excuse me. For a 2-year-old.
Exactly. With atropathy, with affectation of the joints.
Oh.
So you can see how bad it is.
So rapid progression of the disease.
It is an inflammatory bowel disease.
What is the causative factor?
Yes. There are a lot of factors that come in play, but we don't usually have we don't say this is what it is, but these are the suggestion. The cause is
like risk factors, right?
Factors. It involve an interplay of the environment. So you have environmental factor, we have the genetic factor, and let me come back again. Those ones you see in childhood are more linked to maybe genetic mutation or system. So those ones are linked to that, and it runs in family. You know anything about gene runs in family. So those ones has a familiar cause. Okay, so we have genetic factors, you have immune dysregulation, and also maybe there is within the environment in the gut microbiota. Maybe there's abnormal gut microbiota, like the environment within the gut. You have the normal bacterial flora, so the good ones, you have more of the bad ones. So there is usually a dysregulation, and there is overgrowth of the bad ones, microorganisms. So it has to be an interface. So now, for the environmental factor, most of the time we take food. The food contains some antigens or some things, allergens, and we also take bacteria in different forms, maybe from our food, from the environment, and everything. So, and this will stimulate what an inflammation within the intestine. Ideally, the body immune system has a way of containing or curbing all this inflammation. But those that are susceptible to having inflammatory bowel disease, you see what happens is that there is usually the inflammation becomes over there's so much inflammation going on. So now the body is not supposed is not able to control it. So because they have naturally they are susceptible to having that, they have the genetic mutation of the immune system. So the body cannot control it or curb it. So these are the risk factors. So that's how it comes to play. So most of the things we do is we're able to control the inflammation going on in the intestine. And we have two types.
Okay, of the inflammatory bowel
Yes, we
disease.
have two types. We have the Crohn's disease and we have the ulcerative colitis. And both of them have different presentation. Not 100%, but at least when a patient comes to you and say, this is what it presents with, you think, okay, this is likely to be Crohn's,
This one.
while the other one is likely to be ulcerative colitis. So now for Crohn's is more prevalent than ulcerative colitis. It's more prevalent. We don't have any sex deletion, sex predeletion. There's things suggest some researchers says you have more Crohn's in male than female. But these are speculations,
By any age predisposition, any age factor, like you said, people think Crohn's is more in male, but nothing like that.
Nothing like
For
that.
any age,
Ages is just between 15 to 24 years.
25, okay.
Adolescent and young
Adult.
Yes. Or sometimes in 5 to 10%, we now start seeing in childhood the very early onset at the fertile time. Okay, so for the Crohn's disease, because the Crohn occurs commonly at the ileum and the small intestine, and that's where the absorption of food takes place.
Yes.
So you see them, they will have chronic diarrhea because the body cannot absorb the nutrients. So they'll have chronic diarrhea, watery diarrhea. They will have malabsorption, so they are malnourished. So when you start hearing that the person is losing weight, that doesn't mean that ulcerative colitis, they might not, but this is what happens commonly there. Although they have fluttering of weight, of growth, and they also have anemia. Where that's where a lot of things, osteoporosis, because of vitamin D, all this malabsorption, that's where, so they'll come down with that. And also abdominal pain. Abdominal pain is common in both of them. So, but when you're hearing like right-sided abdominal pain or the right flank abdominal pain, you have to think about this, while the left one is for the ulcerative colitis. So now, as I said, Crohn's can occur in any part of the digestive systems, the digestive tract, from the mouth to the rectum. But most of the time, the rectum is being spared. So, and the lesions are usually skip lesions. It's not like the involvement is not it's not a linear one as you see in ulcerative colitis. So now for ulcerative colitis, the presentation is commonly bloody diarrhea because it starts with from the rectum. So you start see passage of bloody stool, you get history of that passage of bloody stool, or you have left flank and tenderness or pain, and there's something we call tenesmus. So you feel like there's an incomplete voiding. You will always want to go to the toilet while the rectum is empty. We go to toilet, you will not pass to bed. Then you feel like
there's something remaining.
If something remaining, so call that tenesmus. This is a chronic inflammation within the bowel, within the digestive tract, within the gastrointestinal system. So not just that it has chronic inflammation, there are also inflammation of the intestine. There are also extra intestinal manifestation symptoms you see. There are other things, it can affect other parts of the body that is not the intestine. So that's what I mean by extra intestinal it's a manifestation or symptoms. So now it can cause uveitis, can cause red eye, it can cause arthritis. Just like I told you that one of the patients we had arthropathy, that the joints of the hand were already curved and had chronic arthritis. So it can affect any system in the body has different, even the skin can affect skin. It can come with skin lesions. So these are the extraintestinal manifestation you see in them. So sometimes when you see some illnesses or disease, you don't trivialize it. You should ensure that you can make a good diagnosis. If you can't, you can refer to the specialist to help out. So early intervention is very
Very
important.
important. So, two-pronged question I want to ask. What is the role of diet, stress, exercise in exacerbating, like acting as triggers to inflammatory bowel disease? And now that we are kind of brought it to the forefront that, look, this is chronic, is lifelong, there is no treatment to it. And we've talked about the presentation. How do we
Manage it.
manage?
Yeah.
Management starting from the diagnosis and
Yes,
treatment.
of course.
Yeah.
Okay, already made the diagnosis. So management is multidisciplinary approach. There's multidisciplinary management for this patient. Involves the physicians, involves the surgeons, involves the dietitian. Just like you asked,
Yes,
diet,
yes.
diet plays an important role in the management of these people. Then also involves psychotherapists because
For the
it's a
mental-
chronic disease. So you can imagine living with an illness. You can imagine how depressing it is. You can go into depression. You are anxious. Everybody around you're in chronic pain. When you see these people, they are chronic in pain, severe pain, abdominal pain. So they will involve everybody, psychiatrists, psychologists. They involve in the management of this patient. So we have drugs that we use, and just like I told you, that what we aim to do is just to control, to ensure that we keep the patient in remission. Remission is when there is no more disease symptoms. All the symptoms the person comes with has resolved. That's what we call remission. Sometimes they have flare. So the disease is usually on and off. Sometimes you have flare until they come into remission. Maybe remission, you see remission in 10% of cases. 10%, yes. So then our drugs we use are anti-inflammatory drugs. We have the one we call sulfasalazine. We use the steroids. Though now we are going to biologics, which is where we are now, the mainstay of management, and we've been getting a lot of good results with biologics. Infliximab, these are what we are doing for the medical management. So for the surgical management, so we usually go manage with the surgeons, especially when the medication had already failed at a point, or with there's perforation, or we have some communication within the intestine that we really need to either dissect some part of the and resect some of the intestine. So the surgeons are also involved. Now coming to the diet as your question, it's very, very important. So we try to advise our patients when they're in remission, they usually have malnutrition, so they try to eat a balanced diet. Eat as much as you can, but we don't encourage to eat so much. You can eat small, small. There is problem with digestion of food, absorption of food. So you don't need to overload or stress the intestine of food. So you have to really take just small, small bits, one at a time. Maybe you can do two or three hourly feeding. But however, everything is being individualized. Everything is being individualized. So we don't generalize the dietary management to be the same for everybody. So first of all, we'll always encourage them to have a food journal or food diary. So that food diary or food journal will help them to write, okay, today I ate so food, and what are the reaction, or how did my body take it? See, a whole lot. So you have to put in so much. So if you didn't have any reaction, day two you write. So you're able to tease out the one you know that you're comfortable with or your body can tolerate. Now, so during remission, as I said, you try to eat balanced diets, eat enough fruits, vegetable, but then we don't fiber. If you're going to take fiber, the fiber should be you have to try, and not the ones that are insoluble like the popcorn and nuts. You have to really know the type of fiber you're going to take. They are now advocating carnivore diet.
Wow.
That is what we are advocating now. There are a lot of people, research have found that it gives a lot of remission. Carnivore diets are like mostly animal based, the animal based diets that has helped a lot of people to go into remission, and there are a lot of research that have proven that carnivore diet is better. Meat, poultry,
A lot of that, a lot of proteinous meals.
yes, cheese. Maybe we can also do vegetable, but it's small. Then we also have to target those diets that are anti-inflammatory, that has a lot of anti-inflammatory properties, like fish oil, avocado. They are really very, very good. But then most importantly, I think you should also involve have a dietitian that will walk the path with you. It's really very important. So that is
Thank
in
you.
management.
So what you have said is actually a very debilitating kind of result. Chronic, and they can actually cause some patients that Dr. Memuna will probably be seeing health
Mental
health challenges.
especially when she said that they're found between ages 15 and young age. So imagine if a 15-year-old is being diagnosed and you have a whole lot ahead of you.
You know, when you're talking about this, it's when you have somebody close to you. When you understand what it is. When you have somebody close to you, they're in pain. Even the family, everybody's in distress. So sometimes at a point, we can even give them antidepressants just to help.
But what is the role of stem cell?
Stem cell doesn't really
Anything?
No, we don't have anything on stem cell for now. Yeah, so we are going to biology, which I told you.
Biology, okay.
Ifeoma.
So with that said, because they're going through a whole lot, depression is key there. How about the stress? What is the result of stress?
Stress can is one of the aggravating factors. It's one of the aggravating factors. So it's also, so we try to make sure that they are really living a stress-free life. They are calm. You make them happy. That's why the psychotherapy comes into play. You know, so stress.
Because the situation enough is enough stress.
It's enough stress, and it involves the whole family.
You know, the expensive, the challenges, the negative effects of stress.
Yeah.
Now compound that.
There's a suicidal effect. You know, when you see, why am I living?
Yeah.
I just rather just go.
What is the prognosis?
He's a chronic. He's not so good. Although when you have good proper care, management, and you're going into remission, it's like 50-50.
Okay. Okay, doctor.
Pharmacy is expensive.
It's expensive to manage. Even the drugs now. This infliximab is so expensive to get one. And in fact, I'm sorry, I'm talking as a pediatrician.
Yes.
For the patients we manage, some cycle of the treatment can take like almost $1 million, depending on the age of the child.
Wow.
Because one vial is like almost 200 something thousand. So you can imagine. So even is the cost management of these patients are also another thing too.
As we're seeing, some parents are just abandon the children.
That's what I was going to say.
They always abandon.
Always.
So when
Not
they come
always, but I've seen someone that.
Okay, so let me just ask this, okay? Someone who's also watching. When the parent brings a child, or you make a diagnosis, do you usually explain to them that this is the condition and this is how I had enough?
You have to.
And when you do that, do you see them coming back to continue the management?
Of course they do. Of course, no parents wants to lose the child, no matter what. You counsel them. You usually tell them what it entails so that they get ready. And at each visit, counseling continues. You don't just counsel once. You have to really encourage them, and that's where the support group comes in. So we encourage them to join. We have a support group. All those patients living with IBD, their parents, they have a support group. So it helps them to cope better.
Well, I just imagine a lot of parents, a lot of children out there not having proper diagnosis made, and they just dying.
Or even being abandoned.
Being abandoned. People dying because they didn't even know that they had IBD. Okay, so I just say thank you. I don't want to say
That's a pleasure.
it's not. It wasn't the today's topic is very very emotional. Yeah, he's one that makes one begin to think a whole lot. Because when you don't even have an institution where proper diagnosis can be made. We talked about the diarrhea that will come, the pain that the child is being. So parents begin to wonder what is this, what is causing this. They can't really hold it, lay a hand on it. At least with this that you have said, I'm sure people have been schooled too, and we'll keep encouraging you. But whenever you have a challenge, symptom, no matter how small, go for proper check.
Okay.
Then one other important thing that you said was the things that don't have to do with the condition itself before you can make your diagnosis. Just extra, external symptom that will arise. Anything that you see is important. Like in medical school, they've always told us some things that you see that are results of a disease condition that is not in somewhere. I want to just say thank you for being part of our program today. And for viewers out there, I want to say thank you for keeping a date with us. As always, we always know that we'll always try as much as possible to bring the best for you on our program, The Physicians. In next week, stay blessed.
Thank you so much, Dr. Ifeoma Ezeoma. Just kind of love that combination and looking so pretty. Thank you so much. Thank you to all our viewers as well. It's not such a good topic, but we just have to bring it to you because we know we have somebody who is already presented with this, but not yet seen a doctor. And this is the reason why we are here at The Physicians, to bring this information to the forerunner, give you public enlightenment, and reduce misinformation and disinformation. Please be kind to follow us on all our various social media platforms. And if you want to be here to share from your wealth of knowledge, from your skills, and able to even express and tell people about your health challenge, or you are even a health enthusiast, this is the right platform for you. Go to our website, thephysiciansng.com, fill the form, and you'll be right here educating the world from your wealth of knowledge. My name is Dr. Mimina Yusuf Kadri. Until next time, remain blessed.
Every day and in every way, enjoy that I find support. No matter the role you play, nutrient pack supplement for you and me. In your body, that I fight you.
Darvite nutritional supplement is loaded with essential multivitamins, minerals, and natural ingredients that helps you to be at your best. Darvite from LB Pharma. Darvite, love yourself.